Well, welcome back. May is Stroke Awareness Month. Listen to this. Every 40 seconds, someone in the United States has a stroke. That's why it's so important to know what to look out for or do if someone you know is having a stroke. Dr. Sunil Sheth with UT Neurological Science, affiliated with Memorial Hermann. Thank you so much for being here. We do appreciate it.
Absolutely, my pleasure. Thank you for having me.
Listen, when we hear these statistics, every 40 seconds, every 3.5 minutes, someone dies of a stroke. Every year, more than 795,000 people in the U.S. has a stroke. It's the fifth leading cause of death. This is really where seconds count.
Absolutely. These are very sobering statistics, as you're pointing out. And this is a disease that has touched so many lives. I mean, just sitting in the green room earlier, 5 people in the room, it wasn't surprising that multiple people had their lives touched by stroke. It's just something that is so prevalent. But I think the way we're going to get ahead of it is using that word that you had earlier, which is awareness. Awareness of how bad this disease is, awareness of the symptoms, awareness of the signs, so we can act quickly, because it really is not even minutes, it's seconds that matter in this disease.
Right, and we can recover. I mean, that is the thing here. So when we're talking about seconds, this is really where it matters. Let's talk about the two major types of strokes, because there's two really different ones that you want to highlight.
Yeah, and both are just as time sensitive, but one of two things can happen. The problem is always in the blood vessels of the brain. And either the blood vessel gets blocked, which means there's not enough blood flow going to the brain, or there's a vessel that bursts, meaning blood is released into the brain and there's pressure caused by that bleeding. So we call it ischemic stroke is the first type, not enough blood flow to the brain, and hemorrhagic stroke is the second type, where there's bleeding into the brain tissue itself.
We've also heard about these TIA type of strokes.
Yeah.
Can you touch on that?
So these are we sometimes call mini strokes, or they're aborted strokes, and this is a situation where you might be very lucky because the little blood clot that was blocking the blood vessel broke up before it can cause permanent damage. But this is really a very, very golden opportunity for people to get checked out, get all their risk factors under control, and prevent the bad one from happening.
And let's talk about some of those risk factors, but also the symptoms. There's quite a number of them. Some of them are kind of more common than we would think, but there's so many things here associated with strokes. And let's talk about that, because it kind of starts even, you hear a lot of this numbness, blurred vision.
Yep. Absolutely. So stroke can manifest in many different ways, as you're saying. One of the acronyms that we like to use, or a mnemonic, is the B.E.F.A.S.T mnemonic, which I think, hopefully many people are aware of. But to go through that, the B stands for balance, so problems with your balance. E is eyes, so vision problems, vision loss, double vision. F is for face, so drooping of the face or slurring of your words because your face is weak. A is for arm, so drooping of the arm, weakness of the arm. It could be the leg too. S is speech, so you can't get your words out, or you can't understand what people are saying, or again, the slurring of the words. And T is again for time. Just emphasize how important it is to move quickly.
Yeah, pay attention to what you're seeing. Doctor, I know we're talking about balance, eyes, arms, all the things that you just went through there. Would there be maybe days before, or these are immediate signs?
And that's the hard thing about stroke, is that it happens immediately. You almost never get a warning sign that's going to happen, and it can happen at the absolute worst times, middle of the night, or even when you're asleep and you wake up and you have these symptoms. But that's where you may not be aware of the symptoms because of the nature of the stroke. You don't pay attention to the part of your body that's weak. But awareness in the community, awareness by your family, your coworkers, your friends, that's what makes the big difference here.
That is true. There's also some risk factors, of course, high blood pressure, heart disease, family history of stroke, obesity, smoking. All of those things can also be risk factors. And there's this conversation, Doctor, really can go on for quite some time. And that's why you have a special webinar coming up on May 24th.
That's right. It's open to the public, again, to get the word out there, to make people aware. We have treatments for stroke, but seconds matter, and the faster you get to the hospital, the better the chance we have of helping you recover.
Absolutely. And as you said, in the green room, there are so many people, so many of us have been touched by this. It's great to have the information. Again, seconds count, and that webinar is coming up on Tuesday, May 24th. There's the information there. The event is free. Space is limited. You can RSVP there online. Dr. Sheth, thanks so much for being here.
My pleasure, Courtney. Thank you for having me.
Absolutely. Great information. And for more information, you can visit their website at memorialhermann.org/stroke. You can certainly give them a call as well, 713-222-2273.